So what's Creutzfeldt Jakob?
Creutzfeldt Jakob disease is a prion disease. It's a protein that causes infection. Isn't that amazing? Dr. Prusner, who won the Nobel Prize, when he first said that, everybody said, "You're crazy." But it's this protein that causes the body's proteins to fold in a sort of a cascade effect. And that protein is deposited in certain parts of the brain. So it's a rapidly progressive, aggressive disease due to this protein. It's also can be transferred rarely, so sometimes corneal transplants can cause that very rarely. There was a catastrophe where they had pituitary, they used to collect all the pituitaries to give growth factor to children, and they squished up all and they had some Creutzfeldt Jakob in that, and they caused Creutzfeldt Jakob in all these children who were getting injected with growth hormone. Now we synthesize growth hormone, fortunately. And also there are some genetic forms of Creutzfeldt, of prion disease. So it's a rare disease, but it's a rapidly progressive disease.
I understand that there's a group of people with mild cognitive impairment that do not go on to get Alzheimer's. Other than the PET scan, which is very expensive, is there any other way of determining if you might be one of those people?
Yes. So what you say is correct. So people with mild cognitive impairment, if you look at a lot of studies, some people revert to normal. A certain percentage of people that in an epidemiological study, doctor says you have mild cognitive impairment, and then the person gets better. Also, some mild cognitive impairment patients just hover for a long time, like that limbic Alzheimer's disease. It depends where in the brain it is. They just have a memory problem for 10 years, mild cognitive impairment, and they don't go on. There are predictive factors that you can use. So if you look at the MRI scan and the hippocampal volume is small, that predicts likely to progress. If you look at the ApoE4, if the person's ApoE4 positive, likely to progress. If they have not only memory problems, some subtle other cognitive deficits, such as inability to make as many words beginning with the letter S, called fluency. Okay, time you for a minute, how many words can you name with S? And if that's also impaired, that it predicts that you have a greater chance of going on to dementia. So there are a lot of clinical ways of doing that. A spinal tap test is probably as accurate as a PET scan. The PET scan looking for that amyloid is helpful if you can afford it. But a spinal tap test usually will be paid for by insurance, but will show you whether the person has mild cognitive impairment due to Alzheimer's disease. So the distinction is your mild cognitive impairment due to Alzheimer's disease or not? And if it's due to Alzheimer's disease, is it one of the aggressive Alzheimer's that will progress? So it's not just a simple question.
As an epidemiologist, I've appreciated your emphasis on risk factors and secondary prevention. But I was wondering if, from your perspective, you see any promising treatments in the horizon for established Alzheimer's?
For established Alzheimer's, yeah. This is a really important question. So I've said, sort of thrown up my hands a little bit, that we've tried so many, more than 33 double-blind prospective phase 3 studies that have failed. That's how, that's the state of our art, and that we haven't been so good. It turns out that an anti-seizure medicine just passed a phase 2. A phase 2 study helping people with mild to moderate Alzheimer's disease. So we'll see whether that'll pan out. That's coming, a phase 3 study will be coming up on that. So that's one of the ones. We've only been using symptomatic treatment of, the cholinesterase inhibitors, Aricept and its brethren, and memantine or Namenda, neither of those slow down the progression of the disease. You saw epidemiologically in the 3C study that treating vascular risk factors seem to slow it of anything. Let me ask you a question. Let me put you on the spot. So if a person had moderate Alzheimer's disease, would you slow it down if you could? That's my question for you. Think about it.
Would you slow it down?
Would you prolong it?
Because they're going to die eventually, is that what you're saying?
Well, you can. Everybody's going to die eventually, but they're going to have a longer period.
That's like having prostate disease. You're going to die with it, not of it.
That's a very good point. Alzheimer's doesn't shorten life that much. But that's true. But would you prolong the period? So let's say we could slow it from a 3 to a 5 year, or it's the average length of Alzheimer's is 6 to 8 years. The range is 2 to 20 years. If we could get more 15-year ones, would we want to do that? That's the question. So, slowing it when people have moderate Alzheimer's disease, I think is an ethical dilemma to a lot of people.
What I have learned here today is that I should tell my grandson to have, at 25 years old, to have his last large bag of McDonald's fries and change to the Mediterranean diet, walk to the lab to finish his doctorate, and have a glass of wine when he gets home. But how do I get him to listen?
It's impossible. He's got to see the light himself, right?
Send them
All right.
CDs.
Should we do one more question then?
Is testosterone used in the treatment of Alzheimer's?
No. Testosterone. Should you use testosterone in the... there isn't enough evidence for that, and there's a lot of risk to that. This low T story is a bit of a scam.
The use of Aricept and Namenda to slow down the progression of Alzheimer's. Will you give us your thoughts?
So it doesn't slow it down, but it is a symptomatic treatment. It's particularly cholinesterase inhibitors are particularly effective in Lewy body disease. Much better than Alzheimer's, in my opinion, even though it's not FDA approved. There is clear studies showing that it's helpful. It's approved in Japan. Dr. Mori's study showed that it does work, but for some reason our FDA isn't convinced. But those of us who treat patients, we've documented that it really is helpful many times. So cholinesterase inhibitors are symptomatic treatments, and we use them. And then Namenda is only approved when the disease is moderate. And it doesn't slow it down. It's a symptomatic treatment as well. So try and use the generic stuff, not the Aricept 23 milligrams, which is not generic, or the Namenda XR, which is not generic. So use generic medicines if you're going to use them.
So let's give Dr. Graff-Radford
Thank you.